To all of my beautiful Guyanese family, I just want to let you know that the Ministry of Public Health would never condone anything in spirit or language that speaks to exclusivity. The issue with the declaration on the ministry's Facebook page is one that should have never occurred. As usual, over the last 2 years, and so in 2020, the ministry, as part of its program, held its sunrise service. This is for all members of the ministry staff. It is not compulsory, but persons from various religious backgrounds would attend. At that church service, the man of God who brought the word made some declarations. Persons asked that those declarations be shared with them, and it should have been shared internally, not placed externally on the ministry's Facebook, and placed there without an explanation, which lend itself to be interpreted by persons that this was a policy statement or a position of the Ministry of Public Health. This is the third year that we have held such an event. The department with responsibility should have shared that request internally with those persons who requested it. For this is the third year that we are holding this event. We looked at the number of persons who worked within the Ministry of Public Health from various religious backgrounds. But we work in a very small place in our various departments. And what we note is that there was a lack of education about the beliefs of various persons within the ministry. And so we set out to educate each other about the three main religions. And over the last 2 years, there have been programs, sunrise service, Diwali, Pagwa, Yom Nabi, Eid, where we have had various interactions by various members of staff within the ministry. And over those 2 years, I must say that we all have learned. We've learned from the Christians, we've learned from the Hindu priests, we've learned from the Hajis who came. And the objective of us having those type of interactions and programs was to foster that tolerance and understanding of each other. And I can tell you that it has been working. And so it is very unfortunate that we would have this blunder whereby a statement is placed out there and not placed in context. As I said, persons did request it, and so the department should have sent it out to those persons who wanted it. It is unfortunate, however, to have read the various statements made by persons based on their own belief. Because really and truly, Guyanese brothers and sisters, it goes counter to what the ministry set out to do. What we set out to do is to bring harmony, to bring understanding, to bring care, to bring tolerance. into our working environment. It means that if you know your colleague is a Hindu, you know they don't eat beef. So don't go and put your bowl of food with beef on their table and think that that's okay, because that person would feel violated. If it's Christian, there are certain things that they hold sacred and dear, then don't say it, because you're going to hurt your colleague. And likewise, if it's a Muslim. And so that is what we wanted to create within the Ministry of Public Health. Not for us to be fighting and saying hurtful things to each other, but rather that we will learn about each other's religious background, religious belief, and so we can truly emerge into that one family, that health family that we're striving so hard to build. So to those of you out there, I ask that you help us to do that and to understand that this is not a statement, this is not a policy by the Ministry of Public Health. So let us ensure that we have inclusivity as we are seeking to build, and not exclusivity.